Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm going to be taking you through my back workout. It is Monday, June the 2nd. It is day 27 of my current 30-day split, and it is day 2, which is going to be my pull day. I'm going to be attempting 360 pull-ups in under 22 minutes, and during the rest periods, I'm going to be teaching you a little bit with regard to how to get better at pulling, as well as assessing from the ground all the way up. With regard to today's workout, I'm going to be doing sets of 12 pull-ups. I'm going to be doing 30 different sets using 3 different grips. And I'm going to be going every 45 seconds on the 45 seconds. And to do that, I'm going to be using my interval timer. Let's go ahead and get started. And then I'm going to start teaching you a little bit in between the rest periods. Set number 1 coming up in 15 seconds. With regard to this workout, my last workout, I ended up doing 360 pull-ups in under 30 minutes. So this is going to be a little bit more. Let's see how it goes. All right, that is 1 set down, 29 sets to go. With regard to this workout, the way that I did this last time, if you recall, was I ended up doing 300 pull-ups in under 30 minutes. I started at 30 sets of 10 repetitions using 3 different grips, and I ended up going from 3 minutes. Every workout, I would decrease it to 15 minutes until I got down to 1 minute. Next set. With this workout, this is the final workout of my current back training routine, and I ended up starting with 30 sets of 12 repetitions on every 2 minutes, and I kept decreasing it by 15 minutes. So the last back workout, it was 30 sets of 12 repetitions every minute. Now it's every 45 seconds. Got set number 3. With regard to today's workout, I'm a little bit heavier than I was on the last workout because I stuffed my face at family barbecue, so I'm a few pounds heavier. And last workout was pretty tough, so this is going to be really challenging. I'm not too concerned with keeping super strict form on today's pull-ups. My goal is to just get through the repetitions. If you're a beginner, be really strict with your form. I've been training for 25 years, so for me, I can break form a little bit. Today's, it's all about volume. With regard to pulling, if you want to get better at pulling, I've got a blog, and it is on the pull pattern, and I have 12 different body weight progressions. It starts from horizontal pulling, if you are incredibly weak or deconditioned, and gets all the way into doing a one-arm pull-up. If you want to get better at pulling, I'm going to include a link in the description. You can check that out. But we're about to get on to set number 5. All right. Now let's get on to the theme of today's video, and that is going to be the joint-by-joint approach by Gray Cook and Boyle. With regard to this right over here, the joint-by-joint approach, it's a way to look at the body from alternating patterns. Starting at the foot is a stable, it's a stable joint. Ankle is mobile, knee is stable, hip is mobile, sacrum, lower spine. Now let's hold on. Sacrum and lumbar spine is going to be a stable joint. Your thoracic spine is mobile. Lower and middle cervical spine is a stable joint. Upper cervical is mobile. Then proximal to distal, scapular girdle. Scapula is going to be stable. Glenohumeral joints mobile. Elbow stable, elbow stable, wrist mobile, hand stable. Set number 7. So if we wanted to assess each joint from the ground up with the foot, we would want to look at stability. For stability, what we could do is see how the arch is. We want to take a look at the medial arch. Is it collapsed? What you could do to assess it, take one fingertip, put it underneath the medial arch. This is going to be dependent on the size of the patient and the therapist. If you're a large therapist and you are assessing a tiny patient, this isn't going to be effective, and vice versa. Set number 8. Oh, the quality of these reps are deteriorating. But that's one way you could assess it. The other way is you could take a business card, place it at the lateral malleolus of the ankle, and the lateral arch and the lateral malleolus should be in line. If there's a big gap between the lateral malleolus of the ankle and the business card, then you know that there's overpronation and a collapsed arch, and you would want to do some strengthening exercises. Set number 9. With regard to strengthening exercises for the foot, one exercise that I love to use with my physiotherapy patients is the towel toe curl. What you do is on a hardwood floor, laminate, or any type of nice smooth surface, you lay out a towel, and with their toes, you have them curl up the towel. Great for strengthening the arch of the foot. Next, what we would want to do is take a look at the ankle, which I'm going to discuss during the next rest. Oh, starting to get hot. With regard to the ankle, one way that you could assess mobility, requires no equipment whatsoever, is you could do an ankle mobility test where you have patient in a staggered stance. So they have the toes of the back foot touching the heel of the front foot. Then you would instruct the patient to squat down, drive the knees forward. We'll get that into a second. Switching grips now, going into a pronated grip. So you would have them squat down, drive the knee as far past the toes as possible, or the heel as possible. And ideally, the knee should be able to clear the medial malleolus of the foot in front. If they are unable to clear it, then they have some ankle restrictions. You would want to improve that with some ankle mobility drills. We will get into that during the next rest period. One exercise you can check it out on my channel is a half kneeling dorsiflexion with dowel rod. What you would do is get into a half kneeling position, so bottom of a lunge. Toes on the front leg are going to be slightly rotated in. The dowel rod is touching the base of the fifth metatarsal on the foot. And then we'll get into this during the next rest period. What you would do, press down on the dowel rod. That's going to activate the core. It's going to bring the pelvis into retroversion because the abdominals attach to the pubic symphysis. So when they're engaged, it neutralizes the pelvis. Then you would have the patient drive the knee as far forward as possible, and you want to go out and past the dowel rod without allowing the medial arch to raise up off the floor and without allowing the heel to raise up off the floor. Set number 4, then we'll get into the knee. For the knee, single leg balance test. What will you do is you would have the patient go into hip and knee flexion. The leg that's on the floor, you want a slight bend in the knee. You want the arms out, close the eyes, have them balance for 30 seconds. If they can't balance for 30 seconds, they may have some instability in the knee, and we would want to perform some proprioception or strengthening exercises to help with stability in the knee. We'll get into that shortly. Set number 5. If we want to work on proprioception, I got a bunch of different knee proprioception exercises on my channel. All of them involve balancing on one leg, and depending on how exactly we position the foot, the knee, and the pelvis, it's going to dictate which part of the knee we are going to be emphasizing. If we want to do general knee proprioception, then just go ahead, balance on one leg with a slightly bent knee. And then there are different factors of progression, which we'll get into in a bit. The factors of progression when you are doing any knee proprioception is hands down by your side, out, a little bit more difficult, overhead. Then you could give little taps, and you want the taps to be random. You don't want to give them in the same time, or you don't want to give them in the same sequencing. So you want to mix it up a little bit. To go even more into the factors of progression, do the same thing with eyes closed. So eyes closed, hands by sides, out, overhead, and then give some pushes. Set number 7, then we'll get into the hip. The hip is a mobile joint. The way that we can assess that, active straight leg raise. With the active straight leg raise, both legs should be completely straight, toes pointing up to the sky. And what you would want to do is be off to the side of the patient with a dowel rod, stand next to them, instruct them to slowly raise their leg up to the sky as high as they can without bending the knee and without rotating the feet outward. What we are looking for this one, I will tell you in a few seconds. Set number 8. With this one over here, we are looking for the medial malleolus of the ankle. Where exactly is it relative to the femur? Ideally, they want to pass mid-femur height because you should have 160 to 180 degrees of hip flexion for adequate mobility. If they can't get above mid-femur, then you want to see, is it between the patella and the mid-femur? If it is, you would want to work on a little bit mobility, and you would want to modify hip hinging exercises. We'll continue in a bit. If they can't even clear the medial malleolus past the patella, they have severe restrictions, and hip hinging is going to be a no-go. We would want to focus on correcting the mobility first before we start strengthening that movement. Next, we're going to go into the sacrum and the lumbar spine. For the lumbar spine, one assessment that we could do to assess for stability is have the patient lay down on their back, lift up their heels, so they're, well, we'll get into this in a second. Or sorry, we're gonna do a trunk stability push-up. Trunk stability push-up, head all the way down to the ground, one straight line. Place the dowel rod on the head, the butt, and the back. They should remain in contact with all of those points. For men, fingertips at the forehead, out so that the webbing of your hand lines up with the axilla. For women, you're gonna go down to the chin. They wanna push up, and you don't wanna see any excessive arching of the lumbar spine. If it is, they got some weakness in the core and some instability in the lumbar spine. Oh, we're switching grips now. If they have weakness in the lumbar spine, some things that we could do for the lateral compartment, farmer's carries. Have them hold something like a farmer's carry handle, dumbbell, kettlebell, barbell in one hand, walk. Whatever hand they're carrying the weight in, the opposite QL and the opposite lateral flexors like the external obliques, internal obliques. That's gonna be what you're working. All right, so number 2. For the front, what we could do some abdominal curl-ups. Got 12 different variations. They're all on my channel. Just search up abdominal curl-up. And then for the lumbar spine, we could do things like reverse hyperextensions, deadlifts. Those are all going to help to reinforce and strengthen the lumbar erectors, the lateral flexors, and normal trunk flexors. Next, thoracic spine is a mobility. To assess mobility in thoracic spine, one assessment that we could do is a thoracic arm raise test. Have the patient go up against a flat surface like a wall, 1 foot length away from the wall. So place one heel toward the wall, other foot in front. That's going to be their starting position. Their butt, their back, and their head all touching the wall. You want 1 fist width so they maintain a neutral spine in the lumbar spine. And then we'll get into this in a second. What we would do is, while maintaining all of those points of contact, you place your hand underneath their lumbar spine. See, with straight arms, can they touch their thumbs to the wall and come back without going into excessive arching of the lumbar spine? If they can, they have good thoracic mobility. If not, we would want to work on their thoracic mobility. One great exercise is going to be a thoracic extension over a foam roller. Get into that in a bit. For the thoracic extension over the foam roller, you would lay the foam roller horizontally so it's perpendicular to the axial spine. Have the patient grasp their hands behind their head. They're not yanking on their head. Their hands are just there for support. Then, wherever they are hypomobile, so they have limited kyphosis, you would have them inhale, lean back. As they can't go back any further, exhale, sink deeper into it, and then come back. 3 repetitions at each segment before moving on the entire length of the thoracic spine. Next, we're going to look at the scapula. Scapula, that is going to be a stable joint. What we can do to assess it is do a wall push-up. When we're doing the wall push-up, we want to see, is there any winging going on, or are they able to maintain the scapula in a nice stable position? If there's a lot of winging, then we would want to do some corrective exercises because there's some instability in the scapula. We'll get into that in a second. So, some exercises that we could do. Number one is a segmental strengthening and reinforcement exercise for the serratus anterior. Serratus anterior, it attaches underneath the scapula, and if it's really, really weak, what can happen is you can get some winging of the scapula. So quadruped position, hands and knees, depending on the arm position, it's going to dictate which fibers we're pressing, but we're going to basically do a scapular push-up in quadruped. So you want to push, separate the scapula, come back, retract. Next, we're moving on to the glenohumeral joint. Glenohumeral joint, this is a mobile joint. What we could do, aptly scratch test. So you would have them reach across, touch the opposite scapula from up top, opposite scapula, inferior angle underneath. If they can't do that, then they have limited mobility at the glenohumeral joint. We would want to work on shoulder mobility. We'll get into that in the next set rest period. For thoracic or glenohumeral mobility, I've got a shoulder mobility drill on my channel, a quick mobility drill, maximum extension elbow and wrist, maximum external rotation. You're pressing away. What we're going to do is abduction in the coronal plane, extension, tuck the elbows in, open up underneath. Then we reverse, flexion, adduction, and open up, reverse. Do that 20 repetitions, 10 in each direction. Last set. And we completed it.
Congratulations, your workout is complete.
That was 360 repetitions of pull-ups in under 22 minutes. They were pretty half-assed reps, but again, the goal for today was just accumulate that volume, get the reps in. With regard to the joint-by-joint approach, I just released a blog by the time this video comes out that's going to be coming out. You could go on my channel, link's going to be in the description. And if you want instant access to all of the exercises and all of the assessments, go ahead, become a channel member. I have every single assessment from the ground up. I have over 200 different assessments you could use on your clients and patients. But that's it. Thanks for tuning in. And we'll see you guys again tomorrow. That was just a tiny taste of what can be found in my members only section. If you enjoyed it, become a member for only $5 a month to get access to hundreds of member only videos.